Hello, I'm Dr. Rebecca Linn-Walton. I'm an Assistant Vice President in the Office of Behavioral Health, and I'm also a social worker. I'm really happy to speak to you today. A year ago, I was set to speak to you in a very different world. We were supposed to gather, make merry, and celebrate some of our system's strongest social workers. I was excited to tell you how honored I felt to be part of the health and hospital system, and that I see every single day how social work is the backbone of much of patient care, how our commitment as a field to working hand in hand with patients, families, doctors, and nurses is why I joined this field and our system. In the last year, this commitment has not wavered. You've held the hands of loved ones when that was possible, taking time to call, text, or reach patients, system support, and family members any time of day or night. Many of us have suffered from the same illness our patients did. Many of us are still suffering from the lasting effects of COVID, psychologically, physically, emotionally, and spiritually. And yet we continue to go on. We continue to bear witness, to hold space for others' pain, loss, and overwhelm. Sometimes we do this for patients, sometimes for staff, and sometimes for family or friends. It is our gift and our calling, but at times it can be a heavy load to carry. I've had the privilege of working with you and can honestly say H&H has some of the best social workers in our field. Today, we honor the work you do each day and the change you make in our patients' lives. Social workers are the glue that holds systems together. I thank each and every one of you for tireless, compassionate, and evidence-driven work. The very first thing many of us remember from our education is the term meet the patient where they are. For social workers, this can mean bringing behavioral health to the emergency department, substance use to inpatient medicine, or depression and anxiety support to complex care clinics. It can mean working in teams to ensure patients get the right discharge plan to successfully recover. When social workers are everywhere, patients and their families receive more holistic care and support. We go the extra mile every single day. We are nimble and we are diverse. We know the ins and outs not only of our system, but the rest of the city as well. In a system where everyone is working day or night for some of New York's most vulnerable residents and communities, we can sometimes feel like unsung heroes, but we get things done anyway. Today we are here to sing your praises. You work with the hardest cases, making sure every New Yorker has the right to compassionate care. When no one knows how to help, you do. We thank you. I thank you. Today is a celebration of you, but it is also a time of loss and grieving. We are grieving the loss of all that we knew. Many of us have lost family, friends, colleagues, patients. Sometimes ours is the only space where others can feel truly safe to be honest. In the midst of our own struggles, it is especially important to stop and take time to honor our work. Even when we are exhausted, even when it feels like we are breaking. If there's one thing I can leave you with today, it is that you are not alone. That social work and social workers will endure, but that we need to support one another to do so. Even when the last person has been inoculated, we will continue to work and it will continue to be essential. We will continue to bolster patients and communities. We often hear that this is not a sprint but a marathon, and yet here we are having sprinted for over a year without stopping. I hope you get the support you need because you will continue to be essential to New York's recovery. I thank you sincerely for all that you are, all that you do, and for letting me into your circle. It is an honor to walk alongside you. Thank you.